Good. So, first of all, to everybody, a very warm welcome to our first European ATS clinic. We had a few already in the United States, and that's something we want to extend now to Europe because most of the families actually live in Europe with ATS. We still have a lot of families in the Middle East as well. So that might be a third localization for a clinic in the future. First of all, I would like to say a very special thank you to Andrea. She is actually the lady that made everything start with the clinics. She is the lady that gets the money to do these clinics. It's a wonderful young woman who really goes for it and helps other families along with ATS. Thank you so much. Also, I needed a lot of help with the organization of this clinic, and Oda, my PhD student, and Lisbeth, the study nurse, did also a lot in the organization of this clinic. So thank you also both very much. So I'd like to introduce the clinic to you because you will meet a few physicians in the next 2 days, and might be good if you would recognize the faces. So you will have Oda and me doing clinical genetics. Ilse will also join us. She is a PhD student working on cardiovascular genetics in general. Then, of course, Lisbeth will also help and guide you around the hospital as the study nurse. Then we have the cardiology team. For children, we have 3 cardiologists that will take part in this clinic, which is Katja, Christophe, and Laura. He didn't escape from prison, it's just a bad picture from the website, so don't be scared, it's a very nice man. And for adults, we will have Julie, who is very experienced in patients with connective tissue disorders, working a lot on Marfan syndrome and related disorders. And Laurent, who is also specialized in congenital genetics, congenital cardiology in adults. Dan is our radiologist who is specialized in cardiovascular radiology and who will do the scan with Therese. Pneumologists, we have 2 pediatric pneumologists. Unfortunately, all the patients are too young to do lung function this time, but maybe next time there will be lung functions for patients. We could see if we can arrange lung function at the adult clinic for Therese, but that's not sure yet. Then we will also do a physiotherapy assessment to look at the motor skill, fine motor skill, and this will be done by Grit. There will also be a neurologist joining her, which is Nele, but I don't have a picture of her. And then ophthalmologist will be Thierry. He will have a few assistants that will help him because we are with quite many that need ophthalmology examinations. So to speed up, there will be 2 other assistants helping him. This is actually our research team for ATS. So we have myself, Paul, and Andy are more like supervising the ATS research. And we have Anne-Catherine, who you already met today, who is working a lot on animal models in ATS, and she will tell us about that later on. Oda is doing a lot of clinical studies on ATS and related disorders like cutis laxa. Ilse is working on cardiovascular genetics. Laura is also making animal models for cutis laxa, so ATS-related disorders. And then Marine is technician who is helping the research, and Lisbeth, as a study nurse, is coordinating the clinical work. So this is a bit the overview of today. So Oda will start with what we know about the clinical manifestations in ATS right now. Then Anne-Catherine will talk about animal models. Andrea will talk about the International Patient Registry we started for ATS. And then I will give a short overview of the current follow-up guidelines for ATS patients and the pending research questions, because that is actually one of the main things to bring patients together. First of all, you can talk to each other, you can exchange experiences you had in the past. But also it's important to centralize data. It's a rare disorder. So we have about 100 families worldwide. So we need somehow a system to put all information in one big box. So we can learn from that, and we can decide what needs to be done in the future, both for clinical management as for research. And then we will, if there's enough time, but I think so, we will have a short visit to the zebrafish facility so that you know how this works, like working with the zebrafish, how is everything organized. So that would be a good experience to see once. And then this after all this, around 6 o'clock, we will go to the city center where we have dinner. So those who would like to join for dinner, they are welcome. Those who say, well, we would like to have a quiet night after the journey, that's also good. And then you can go back to the hotel, otherwise would be fine. So you also all have a map with a personal schedule for the next 2 days. Maybe just a few things to remember. We are very grateful that you make an important contribution to our knowledge. That's not only for physicians and researchers, but it's mainly about yourself. It's also important to talk to each other, and I think that won't be a problem. Everybody was sitting quite cozy together at the hotel, so that's great. Never be afraid to ask something. We are here, so you know all the faces. Just come to us and ask. Please always respect each other's ideas and wishes. Everybody should be open to discuss and say their opinions. Just be careful. The patient organization will pay for hotel 3 nights. If any incidentals occur, any damage to properties or whatever, that would be at own expense, of course. So just to make good things. All right, so then the first that will speak will be Ade. Dat mag, we mogen het ook overschakelen tegelijk.
We need a little of that. Okay, so where do I have to?
If you can go up, I just don't want this ugly cord
yeah.
showing.
Here,
Oh wait, no.
unplug it. I can do it here,
Yes.
maybe.
There you go.
Yes. And now I have to put it.
There? Or does it need to be higher?
No, that's fine.
Okay.
I'm not being harsh with you.
Yeah, we're not trying to touch your boobs.
Actually,
No, it's okay. It's okay.
Oh, well, in that case.
Can I maybe stand over here because I have quite a lot of animations,
So I have to press it a lot. I don't know if it's a problem. Yeah. Wait a minute until you move the camera.
Yeah, give me just.
Yeah, okay. Okay, so good afternoon everyone and welcome to the first European ATS clinic here in Ghent. Bert already introduced me, so I'm Ode. I'm a PhD student of Bert and a dermatology resident. Today I'm going to speak to you about the clinical features of ATS. I'm going to give a little overview of the arterial tortuosity syndrome. A first question for all is what exactly is the arterial tortuosity syndrome? Most of you already know it's a very rare genetic disorder. Why do we say very rare? Because it only affects 1 in 10 million people. It is characterized by the lengthening or the elongation and the twisting or the distortion, which we call tortuosity, of the large and middle-sized arteries, which you can see on the picture. This then results in the formations of kinks and loops, just as you can see here as the arteries, but you can also compare it with a river which makes turns in its course. As I already said, arterial tortuosity syndrome mainly affects the large and middle-sized arteries throughout the body. Arteries are the blood vessels that carry away the oxygen-rich blood away from the heart to all of the different organs, so they are very important. The arteries, besides the tortuosity formation, they also can undergo other complications. They can become larger, they can have dilatations, which we then call aneurysms, but they also can become smaller, they can narrow, and then we call it stenosis, which you can see here on the pictures. What exactly causes the arterial tortuosity syndrome? Well, we know that it's a hereditary condition that you inherited from your parents. We say about ATS it is an autosomal recessive inheritance of the non-working SLC2A10 gene. Now, how does it really works? Now, every person here has 2 copies of every genetic factor, every gene in his body. For the autosomal recessive inheritance pattern, we know that parents have 1 working copy of the gene and 1 non-working copy of the gene. We call those people carriers because they are not affected. However, when they have children, they have 25% to have a child with the condition, because then the child has 2 non-working copies. They have 50% to have children that are also carriers, then they have 1 working copy and 1 non-working copy, and they have 25% chance that the child doesn't have the condition and isn't a carrier, so he has 2 healthy copies of the same gene. Now, the SLC2A10 gene. Again, what is a gene and what do genes do? Genes are very important for the body because they carry information that determines your traits. How you look, how tall you are, what the color of your eyes, everything is written down in your genes. They are passed on to you from your parents. Especially for the SLC2A10 gene, of which we know it causes arterial tortuosity syndrome, we want to know what it does. However, we do not know really yet. We know it has a role in connective tissue, and especially in elastic fibers, but the specific role and function are not known yet. That's why it is very important to perform further research on patients. So what are elastic fibers? Elastic fibers can be found throughout the body in a lot of different tissues, such as the skin and the lungs, also in the arteries. They provide these tissues with the property of elastic recall and resilience. In fact, they allow the tissues to stretch just like a rubber band. How do we know that ATS is associated with elastic fiber formation? Well, we already did some studies in normal skin and in patients with ATS in their skin. When we look at the elastic fibers in the normal skin, you can see them here. Oh, not so good. You can see them here with the purple bands. However, when we look in the skin of arterial tortuosity patients, you don't see them anymore. You see that they are less more present and that they're really fragmented. So here they're a lot more thicker than in the other two samples. I hope you can see it a little bit. We also know it because we performed electron microscopy in the skin of arterial tortuosity patients. Arterial electron microscopy allows you to look at the cells at a very large magnification. It has a far greater resolution than the normal stainings. And here, in fact, we see a single elastic fiber. You can see it consists of the black core, and it is surrounded by microfibrils, which are small molecules around the elastic fiber. However, when we look at the patients with arterial tortuosity syndrome, you can see that the core isn't really in continuity with the microfibrils. It's much more loose, and you also see that the black is formed much more in globules, so it isn't connected anymore. So that's why we think it has to do with the elastic fibers in the body. Now, very important for you is to know what can be the different symptoms of arterial tortuosity patients. Very recently, we made a study in a large cohort of patients. We studied 50 patients, so for such a rare disorder, that was really a lot. And we know that ATS affects many different organ systems. We know that it can mainly affect the blood vessels and the heart, the skin, but also the eyes, the skeleton and the joints, and the lungs. When we look at these patients, we see that they have typical facial features. They can have a long face, a beaked nose. They also can have rather large ears, and they have a highly arched palate. However, as you can see in the pictures of these patients, it can be quite variable. Some people have more typical characteristics than the other ones. However, it's very important to look at these different characteristics because it helps us clinicians to recognize the ATS patients and to ease the establishment of the diagnosis. A second very important thing of the symptoms are the connective tissue manifestations. On one hand, you have the skin manifestations. Many patients have a soft, hyperextensible skin, or they can have loose, non-elastic skin like cutis laxa. But we know that they also have normal scarring and no wound healing problems. So that's also really important for if they undergo surgery or if they hurt themselves. A second manifestation are the herniations. They can have diaphragmatic hernias and inguinal hernias, like you can see on the picture above. In this case, in a herniation, a tissue or an organ will abnormally exit through the wall of the cavity in which it is located. So like a small piece of bowel will come out. They also have joint laxity, as you can see on the picture below. We also identified several musculoskeletal problems. Patients can have pectus deformities. You can see this on the picture there. They can have the thoracic cavity, which goes to the inside. They also can have long fingers, as you can see on the X-ray above, which we call arachnodactyly. Patient also can have problems with the spine. The spine cannot be, it can be the case that it's not entirely straight, and then we call it scoliosis. And also we found that many patients have joint pain and muscle pain. Of course, very important are the cardiovascular problems. It's arterial tortuosity syndrome, so we know that the tortuosity is present in all patients. It mainly affects the aorta, the main artery of the body, but it also can affect every other middle or large-sized artery in the body, such as the lung arteries or the neck arteries. And we also saw in rare cases that even the brain arteries can be affected. Like I already said, it can be associated with stenosis. We found that almost half of the patients had a stenosis, so a narrowing of their lung arteries. We also found that the large blood vessel, the aorta, had a stenosis that we call aortic coarctation. And in some patients, we also identified a renal artery stenosis. This is important because it can be associated with hypertension. Another important cardiovascular problem for our patients is that they can form thoracic aneurysms. So dilatations mainly of the aorta of the large artery. These aneurysms can be very large and they can also occur at young age. We saw them in small babies from a couple of months to almost children of 4 years. However, we think they have a very good prognosis because none of the children had any dissections or ruptures, which you could expect with these large diameters. So we think they have a good amenability to surgery and therefore a very good prognosis. Some other cardiovascular risks include stroke and also ischemia of the bowel due to the stenosis of the bowel arteries. We also, in our case series, identified lung problems. Those lung problems were mostly present at birth, and we called it neonatal respiratory distress, because right immediately after birth, these patients had difficulty breathing. So it's a very severe symptom, but we also saw that they recovered very well when they just got standard neonatal care. So also they had a very good prognosis. A very recent discovery was the eye problems in the ATS patients. We already know they had some problems that they could be nearsighted, but recently in collaboration with the Arkansas Children's Hospital, physicians found that in patients who were examined with automated keratometry, which you can see in the picture there, it's just a regular eye exam, that they have corneal thinning. The cornea is the outer layer of your eyes, and it became thinner. When it becomes thinner, it can result in keratoconus, keratoconus, or keratoglobulus. These are difficult names for changes in the shape of the cornea, as you can see down there, like a cone-shaped cornea in the case of keratoconus. It's important because it can cause symptoms like blurred vision and light sensitivity. However, for this, we have some good news because they discovered there was maybe a possible treatment in which they did cross-linking for the collagen in the cornea, and this can heal these patients. However, we need to do some more investigations in ATS patients to be sure if we can use it, so it has to be continued. So now you know what are the main features of our ATS, and on this is also the clinic is based on these different symptoms. In our clinic, like Bert already said, we have a multidisciplinary approach, and that's why you or your children will be undergoing a series of different examinations. You will be undergoing by me or by Bert full clinical examination just to look at all the just look at the whole body. For the blood vessels and the heart, you will get an echocardiography. We will, in the case of echocardiography, we will look with ultrasound to the structure of the heart and the large blood vessels. You also get an electrocardiogram. In this, we use to look at the electrical activity of the heart. Some of you, like Tyrese, will undergo an MRI which allows us to map all of the blood vessels in the whole body. Furthermore, for the case I just described, you will be undergoing an ophthalmological examination, so we will know if really almost every patient have the corneal thinning or not. We also hope to do a pulmonary function test, so that's maybe something to do in the future, because we suspect there may be some pulmonary symptoms. And you will also be undergoing an ultrasound of the urinary tract and Doppler of the renal vessels to see if there are stenosis of the renal arteries, as we found in some patients. And finally, I will also be taking skin biopsies in some patients. This is important because it allows us, just like you saw on the picture, to look with electron microscopy, also to perform other functional studies, which allows us to look at the role of the SLC2810 gene. That's why I will be taking them. So thank you very much for your attention. And if you have any questions, you can always ask me.
Thank you.
Thank you.
Thank you.
Will tell us about animal modeling and research methods of the past years on yes. If you have questions, you can always ask, or we can have questions at the end.
Would you mind sharing the slides so that I can share them
Sure.
with everyone else?
We can share the slides.
Okay.
So don't waste your time noting everything down.
If you could go
Down.
up your dress so that we don't have this black stripe.
Under my dress.
Go around.
Like this? I could do a subtle probably. Could. Okay.
Can you email me copies of your slides?
Yeah,
I can drop
of course.
them.
Like that. Okay.
Yes.
Whoa.